Hello, this is Dr. Stanley Lang. Welcome to this video. The presentation today is on how to fix high triglycerides and different elements of what goes into high triglycerides. So first of all, what are triglycerides? Well, these are basically fats that float around in the bloodstream. There are different forms of triglycerides, which I won't get into, but they're different from what we call cholesterol, which is actually a fat and a protein put together, which is called a lipoprotein. So triglycerides are just fat, and they're used in a lot of different ways, and the body can use them for significant fuel sources. But most of the time in Western medicine, with dealing with people who have the usual American diet, triglycerides are considered more of a risk factor for heart disease than anything, rather than a fuel source. So one of the things that happens when people go into what we call insulin resistance is that the body creates a signal that tells the liver to start to make more of these triglycerides. And at the same time, that same signal tells the body to stop making as much good cholesterol. So the HDL drops at the same time. As it turns out, the triglyceride HDL ratio is a very accurate predictor of risk for heart disease, much more accurate than the so-called bad cholesterol levels. And I want to tell you about a patient that I saw today who I've been taking care of for more than 10 years for this problem. And when I first started to see him, his triglycerides were well over 800, almost 900. And that's where he ran all of the time. And back before I was as knowledgeable about low glycemic eating and how to address triglycerides with just dietary strategies, there weren't too many things we could do except to give medication and try to help the person eat what we thought would be helpful, which is a lower fat diet. Well, it turns out that that doesn't help at all, because triglycerides are created from extra carbohydrates. So a low fat diet doesn't help triglycerides, it helps cholesterol. And so with this particular person, his cholesterol levels were actually low normal. So he didn't have a cholesterol problem at all, but he had this huge triglyceride problem. And his HDL, good cholesterol, was really, really low because his body was signaling his liver to stop making the HDL, and that's exactly what he did. So the solution is to eat in a very low glycemic way. So eating low glycemic means to eat in a way where the blood sugar doesn't rise rapidly and the insulin doesn't rise rapidly. There's a second thing that you have to do when you have really high triglycerides, and that's to take a lot of extra omega-3 fatty acids in the form of fish oil. Now, most of the time, I use these fish oil fats in moderation, because I think that the essential fats are more important. But when you're coming to this kind of an issue where somebody has really high triglycerides, then using really large amounts of the fish oil will lower the triglycerides. But if you don't eat really low glycemic at the same time, you won't raise the HDL. It stays down in the basement. So this person is dealing with major cardiac risk, and so he started on my standard low glycemic eating plan, and within less than 6 months, his triglycerides had dropped down to a normal range. Now, the last time that they were checked, they were actually lower than 100, which is lower than most people ever achieve who don't ever have a known triglyceride problem. So his triglycerides are very well controlled now following this very low glycemic eating plan. It's a simple plan, and I can easily give you insight into the plan with a free report called Why Am I Still Fat? That you can get by clicking on the link below this video if you want it. And the point is that if you follow this plan, you can control your triglycerides easily by eating in this way and supplementing with enough omega-3 fatty acids. And at the same time, your HDL levels will rise. So this dramatically changes the risk for heart disease. Now, this person also became diabetic about the same time that he was wrestling with these high triglyceride levels, and that's no surprise because the underlying mechanism for the triglycerides was severe insulin resistance, and he had just progressed a little bit farther and became overtly diabetic. Since following the plan, his A1C numbers have been in the 5.5 range for now more than 8 years. So I've been tracking him a long time, and he's an example of that, that this kind of a program works long term, unlike medical treatments, unlike medications, which for a while might decrease these numbers, but if you don't fix the underlying chemistry, then it gets worse again. In this case, he's maintained easily the blood sugar average in a very good range, a non-diabetic range, for more than 8 years. So he's essentially reversed his diabetes by following this very simple program. There's a few nutritional supplements that he's taken along the way, which I'm not going to get into, but the core of it is simply eating very low glycemic. Again, you can get information on how to do that by getting the free report that I have made available here, and that will help you to reverse a high triglyceride issue. It will help reverse diabetes. It will help rapid weight loss. And if you have any kind of chronic degenerative disease, it's going to help that too. So I hope you found this information helpful. I wish you well, good health, and God bless.